Gut Health with Dr. Krishnan Sriram, Consultant Colorectal and General Surgeon.
Hi everyone, I'm Datuk Dr. Krishnan Sriram, Consultant Colorectal and General Surgeon at Gleneagleskotakinabalu. And today I'd like to talk to you something that's more common than what you might think, which are colonic polyps. What are colonic polyps? Yeah, these are small growth that develops on the inner linings of a colon and rectum. And most of the time they are harmless. But here's the thing, some of them can turn into cancers over time. That's why early detection is extremely important to detect or to tackle this. Yeah. Now let's look at the causes. What actually causes these polyps? Most of the time we don't know what exactly causes this polyp, but there are few factors which may increase the risk of you having a polyp in you. This includes age. The higher the age goes, the chances of you having polyps also increase. Yeah, if you have a family history or certain genetic conditions where basically polyposis is one of the thing inside, may also predispose you to have more polyps in your colon. Other than that, which doesn't have much evidence but has got a bit of factors could attribute as such as diet, smoking, lack of exercises, being overweight, indirectly increases your risk to have polyps to a certain extent as well. Yeah. How do we diagnose polyps? Yeah. Most of the time, or basically almost all the time, polyps are actually diagnosed during colonoscopy. Yeah. It's either could be a root screening or during examination for procedure. This is a procedure where we use a thin, flexible tube scope with a camera that examines the entire colon. Yeah, most of the time when we see a polyp during our colonoscopy, we remove them at the same time, and patient don't even have pain during that procedure for this. Yeah. As for the treatment, our primary aim when we see a polyp is actually to remove polyp completely and prevent them to progress further to more serious condition, as I mentioned earlier, cancer. Yeah. Most polyps are removed during colonoscopies. Yeah, and sometimes large polyps, or where we're suspicious of cancer, we might need to proceed with the surgery to remove that part of the colon. As we all know, polyps are just not one type. There are many types of polyps. They could be hyperplastic polyps, which is the safest, and they've got almost zero risk of malignancy. Yeah. The other polyps are which more commonly seen is the adenomatous polyps. These polyps, again, most of the time we can divide them into either low grade or high grade. Yeah. And this polyp has a tendency to become cancer over time. 5 years, 10 years, we are not so sure. Yeah. The other types of polyps are such as amethymatous polyps, juvenile polyps, which can be found during colonoscopy, and these are usually confirmed that this is the type of polyp when we send these polyps for histopathology assessment. Yeah. Treatment for polyps very much depends on the size of the polyp, the shape of the polyp, whether it's a flat type of polyp or it's got a long stalk, also the numbers. Yeah, whether it's a single polyp, multiple, or the entire colon is carpeted with the polyp. Yeah, and also the site, whether it's a colon, rectum, and so on. Yeah. Treatment for polyps, the most commonly done is actually the polypectomy. Yeah, you put in a wire below the polyp, yeah, and then you just snare the polyp out. That's one of the easiest way. Yeah, there are a bit more complicated procedures depending the more complicated polyps such as endoscopic mucosal resection, endoscopic submucosal resection. These three procedures are usually done during colonoscopy. But the other procedures are also done for polyps that requires a bit of surgery. These are transanal minimally invasive surgery, which are to remove large polyps, especially in the rectum, or resection surgery where you need to remove part of the colon. Yeah. You might ask, once I've removed the polyp, do I need to follow up? Yeah. The answer is yes. The follow up depends on the type of the polyp, the number of the polyp, the completeness of the polyp being removed, and Based on this, the doctor will actually plan your subsequent colonoscopy and assessment. Finally, I would like to stress that importance of lifestyle changes. Yeah, a balanced diet rich in fibers, yeah, with its fruits, vegetables, and grain, regular exercises, avoiding tobacco and alcohol, all can reduce the risk of having new polyps in you. Yeah. To sum up, polyps are treatable, and with the right steps, we can reduce the risk of complication. Don't wait. Yeah. That's why it's extremely important for us to screen our colon when we are age of 45. It's not to detect cancers alone, but it's also to detect polyps and remove them at the same time. You have any concerns, please consult a colorectal surgeons and they'll be able to help you. Thank you for listening, and as always, stay healthy.